Okay, Bismillahirrahmanirrahim. Assalamualaikum and a very good morning to all of you, ladies and gentlemen. Welcome back to my channel. So today we are going to continue our discussion. Yesterday we continued already our discussion, but now we are going to continue back our discussion with our candidate. So together with me is Puan Azlina. Assalamualaikum, Puan Azlina. How are you today?
Waalaikumsalam warahmatullahi. Cik Syazwan Aizat. Alhamdulillah. Thank you. Very good
Okay,
today.
sorry to trouble you on this weekend. Same also goes to our another panelist, Puan Masdila. How are you, Puan?
I'm fine, thank you. Alhamdulillah.
Alright, and then not to forget our presenter here, Puan Nur Amalina. Puan Nur Amalina, you are live from where, Puan?
From my home, it's Tapak.
Oh, okay, in KL lah. Alright, so today Puan Nur Amalina are going to present about seminar in occupational safety and health. So without further ado, I would like to invite Puan Nur Amalina to share her slide and continue with her discussion and presentation. Silakan Puan Nur Amalina, the floor is yours.
Alright. Assalamualaikum to the panel, Mr. Aizat, Puan Azlina and Puan Masdila. I'm Normalina binti Ibrahim, and today I'm going to present about my OSH. There are 3 activities, so I'm going to start with my video. Okay, that's all for my video. Today for my first activity, I'm going to present about handling hazardous drug, and the drug I choose is vincristine. Vincristine is an anti-neoplastic agent which need MSHG manufacturer safe guidance, and it is listed in FDA pregnancy category D. Hence, it is harmful and need to protect personnel from being exposed to the agents. The personal protection we need is the Tyvek jumpsuit, N95 respirator, goggles, chemo glove and surgical glove, double gloving. We need to use chemo gowns and we need to use booties as well. And the vincristine need to be reckoned inside the class 2 type A BAC, and the cabinet must be sanitized using alcohol 70% before using it, as it is and sterile preparation. So while handling needles and the vial, we must practice aseptic technique, and then to avoid coring, we must practice the technique which is pushing needle inside the rubber band 45 degree and then 90 degree to avoid coring and leakage for our safety. And we use positive negative pressure technique also for safety. And while using the positive negative pressure technique, the technique is when we fill air inside the syringe and shoot the air inside the vial, the solution will flow toward the syringe and reducing the pressure inside the vial. Equal pressure inside the vial and syringe will avoid spillage in between the preparation. So when spillage happen, the spillage might happen while we transferring drug inside the component area, while transferring drug inside the clean room, while reconstituting inside BAC, and while packaging in labeling room. So when spillage happen, we must have spill kit. The spill kit we must include 2 pair of glove, 1 piece of chemo gown, 1 pair of safety goggle, 1 pair of N95 respirator, 2 piece yellow waste bag, 1 pair of booties, 1 set of warning sign, 1 pair of scoop and scraper, 1 cable tie, 1 set of absorbent paper, dry wiper, and 1 small sharp bin. So how to clean the spillage? We must alert people to evacuate the area, and then after alerted people, we must put warning sign, 1 sign from the area, 1 meter from the area, and then first we must put the absorbent towel onto the spillage and then wear PPE provided inside the spill kit to protect ourselves. Using scraper and scoop the towel and put inside yellow bag or sharp bin outside. From how to clean it, we must wipe it from the outside area to the inside area, and then clean the area using Decon 90 to neutralize the agent, and 3 times using water to make sure it is well clean. And then put all the waste inside the yellow waste bag, and then we must remove all the PPE and put inside the second yellow waste bag and tie the bag using cable tie. The incident report must be formed and then submit to the pharmacist in charge. To protect other personnel, the waste management side, we must label all the waste contain cytotoxic drug using cytotoxic label. To remove the PPE, donning the PPE, we first we must remove the outer layer, the surgical glove, and then the N95 respirator, and then the surgical mask, and then the goggles. Then we must remove the jumpsuit by rolling it down, and then remove the booties and cross out. Then after that, we can cross over the bench. Lastly, we remove the chemo glove, and then we can tie the bag. Okay, that is for my first presentation, activity 1. And moving on to my second activity about manual handling. So my topic is about My topic is about ergonomic manual handling. So, my highlight here is about the chair. Inside the clean room, we are provided with a biosafety cabinet and a chair. And the chair is in the clean room. We must sit for around 3 hours preparing the preparation, and then we must sit on a chair which is made from steel and it's very hard, and the chair is static without the backrest, so it is very painful sometimes. And for very short people, for very little people, the chair is the chair have a limited adjustable height. We can adjust it, but the height is very limited. And it is so small as you can see here. And for a little big person, or for obese person, it is very uh, uncomfortable. So what's going in there? I'm going to tell you again. The product recall usually took as long as 5 hours or more in front of the biosafety cabinet. In the limited space, we are provided with steel chair. However, this chair is made from steel and it doesn't have a backrest. With the limited adjustable height, sometimes the individual need to bend his body to obtain a better view inside the cabinet and it can cause muscle restriction and around the shoulder, neck and hip. So um, so we have to do something with this. So how to manage? We must don't overcrowd the BAC so we can have more space and more comfortable view inside the cabinet. Position all the work supplies as close as possible so we can avoid turning ourselves very so we can avoid turning ourselves. So use chair that can turn. We have chair that can turn, and then to avoid twisting our body that can cause back pain. And we can provide ourselves with chair with backrest even though it is from steel, because steel is lebih tahan lama lah. And then it is easy to clean compared to other material. So it is suitable for our biosafety cabinet and clean room. So if we work for a very long time, try to place your leg on the footrest for better support of your body. So this is for my two. That's all. This is my poster. And then we're going to continue with our my safety dust sheet. So it is about a chemical called malathion lotion USP 0.5%. So malathion lotion USP 0.5% is usually used for head lice. So how to apply it? We apply it on hair and before we take our bath usually lah. And then this is the product. The product STS, the appearance and odor, it is usually clear, colorless to pale and yellow. Immobile oily liquid with terpene-like odor, so it smells a little nice like flower. Lepas tu, it is essentially free or has or opulence. The storage condition, it is must store in a tight container, should be handled storeable and store at 20% to 25%. This material is stable in normal condition, but if it is exposed to heat, it will produce a fume, produce another smell. So it is very irritating. So the hazard identification, it is acute toxicity oral category 3, which means it's slightly toxic and irritating. It can cause serious eye damage or eye irrigation category 2B, but it can fully reversible within 7 days of observation. So sensitization of skin category 1, and then carcinogenicity category 1B, which is personal have a potential of carcinogenic for potential based on animal evidence. So firefighting measure, no unusual fire or explosion hazard noted. Then if fire is caused, the suitable extinguishing media will be water form or dry chemical powder such as carbon dioxide. This is the mark. We use exclamation mark because it irritating to skin and eye, and it can cause a little slight effect on skin sensitizer, and it is acute toxicity. It is a health as hazard, which is carcinogenicity category 1B, and then corrosive. It is skin corrosion and can cause burn, and it is incompatible with oxidizing agents such as magnesium, amine, strong alkalism. So first aid measure, if we are exposed to inhalation, if we were exposed, we must remove to fresh air, keep at rest in a position comfortable for breathing, and call a physician if symptoms develop. If contacted to skin, we must remove the contaminated clothing immediately and wash skin with soap and water, and skip medical attention if symptom persist. For eye contact, immediately flush eye with plenty of water, remove contact lenses, and get medical attention if irritation develops. If you ingest the chemical, must call a physician or poison center, control immediately, rinse mouth, do not induce vomiting unless instructed or advised. So the PPE, we must keep unnecessary personal away, wear appropriate personal PPE, avoid inhalation, do not touch damaged container or spill material unless wearing appropriate protective clothing. And then the method, we must absorb the spillage with suitable absorbent material. Clean the surface thoroughly to remove residual contamination. So this is the PPE we can use while preparing the preparation. We must use isolation gown, the face mask which is NIOSH certified, eye goggle to protect our eyes, glove to protect our hands. So for my hierarch form, it is about preparing this malatayon. I'm going to present my hierarch in Malay lah because my slide is in bahasa Malaysia. So hierarch ni dibuat di Jabatan Farmasi Pengeluaran. So lokasi hierarch dibuat adalah bilik, lokasi persediaan dibuat adalah bilik extemporaneous eksternal. So untuk aktiviti pertama adalah menyimpan ubat malatayon lotion USP 0.5. Hazard adalah ubat jatuh semasa penyimpanan, dan kesan daripada hazard ini adalah kecederaan. Kawalan risiko yang sedia ada adalah menyediakan spill kit dan memakai PPE yang bersesuaian. Kemungkinan hazard ini berlaku adalah biasa. Keterukan adalah sedikit menyebabkan sedikit kecederaan. Tahap risiko adalah 8 dan medium risk. Lepas tu langkah kawalan yang boleh ditambah adalah letakkan tanda amaran. Lepas tu tidak menyimpan ubat tersebut di tempat yang tinggi dan susah dicapai, dan kekalkan langkah keselamatan yang sedia ada. Aktiviti kedua adalah mempancuh malatayon lotion USP 0.5. Hazard yang berlaku adalah ubat tertumpah semasa penyediaan, dan ubat ini bila tertumpah ia boleh menyebabkan kecederaan kepada kita. So kita kena pakai PPE yang bersesuaian dan masukkan tanda-tanda amaran dalam kertas kerja persediaan. Kemungkinan untuk berlaku adalah sering berlaku, dan keterukan mungkin boleh menyebabkan sedikit kecederaan. Dan tahap risiko adalah medium risk. So, sediakan sedikit, kekalkan langkah keselamatan yang sedia ada. Lepas tu, aktiviti kedua adalah, hazard yang kedua adalah bila ubat tercampur dalam sediaan internal. Eksternal tercampur dalam internal yang boleh menyebabkan cederaan. So, sekarang sedia ada, diorang dah asingkan tempat penyediaan ubat eksternal dan internal dan paparkan label bukan untuk diminum. Kemungkinan untuk berlaku, dia boleh berlaku di masa hadapan, tapi keterukannya adalah serius sekiranya tertelan bahan kimia eksternal. Tahap risiko adalah 9 dan untuk penambahbaikan gunakan label berwarna merah sebagai tanda amaran dan kekalkan langkah keselamatan yang sedia anda dan boleh gunakan rawatan alternatif sekiranya ada. Okay, that's all for my presentation.
Okay, all right, thank you. Okay, check that one. Thank you, Puan. Cik ke Puan? Cik Nur Amalina binti Ibrahim. So I think I take them from my moderator, Cik Aizat. So without any further, we go to Puan Azlina Abdul Karim for her comment and additional comment regarding the presentation. Proceed to Puan Azlina.
Thank you, Pamasdila. Yes, thank you, Pamasdila. Amalina, can you hear me?
Boleh Puan.
Alhamdulillah. So, how do you feel? Relax, release after the presentation. So, congratulations with the presentation. Very smooth one. Especially well explained regarding your slide. In terms of the flow of the SOP and I love the way you explain regarding the last part of the SOP towards the people handling those things after you put in all your PPE that you already used inside a hazardous bin or hazardous plastic, and then it will help the person, the final person or other person that were handling this thing know that what contains inside the bin or the plastic itself. Okay. It's good for them to know that what are the things that they are exposed to, right? The hazard might be exposed to that, okay? And then regarding your poster, and of course, sorry, the video, yes, same goes to you and the yesterday presenter, record video on your real situation. I love the things, okay? And then your poster, yeah, you're focusing on one only hazard or risk, that is agronomy, right? The chairs that you use to handle the chemical at a BSc is good. The picture, I think, synchronized with the hazard or risk that you're trying to explain. Then when people that is not in your area see the poster, inshallah, I think they know what actually is you're trying to explain to them. And rather than that, I think all good. Okay, thank you, Pamasdila.
Thank you Puan Azlina.
Thank you. Back to you, Pamasdila. Thank you.
All right, thank you, Puan Azlina. All right, I take first to comment before Cik Aizat. We pass to Cik Aizat. Okay, overall, congratulations, Cik Nur Amalina, for the very confident and calm presentation. Very good. And overall, your slide is perfectly and it's good use in color, it's good in using your graphics, and also the size font is also suitable to the slide. Okay, regarding to your video, simple but it's already covered all the content that we required. And unfortunately, I think the video is too fast. And also the notes at the video is too small. The font for the video is too small. So sometimes when it's video rolling too fast, we can't see what is the information that you put over there. Is it clear, Amalina? All right. Uh, okay. Do you hear me? Okay, right. So for the task number 2, nice poster also, and fruitful of knowledge, which is you as Puan Azlina said before, they are cover all the scenario in the area, and also uh, you give the scenario and the problem of the scenario and also the solution of the scenario when you are handling or doing the activity over there. And last but not least, for the hierarchy form, overall is overall is okay, but please make sure to identify when you put the number of the likelihood and also the severity. Must based on the report and also must based on the statistic kalau berlaku kemalangan dekat tempat kerja, dan also must identify the rate risk of the exactly the agent itself. Okay. And last, for the kawalan risiko, please practice to use the hierarchy of the control. Firstly, going to the isolation first, and last is the PPE. Jangan jump to the PPE first lah. Okay? Okay, that's all from me. I pass to Encik Aizat, our moderator. Thank you.
Okay, thank you Puan Amalina for your presentation. It's a very simplified version of your explanation. It's a very well explained also. Your SDS is comprehensive, even though 16 component should be explained, is already being compressed into several ideas. I believe this is one of the good way of presenting your SDS lah, rather than just everything. So my question actually only focusing on two parts. The first one is your poster. So I believe your poster talking about the chair and also the ergonomic hazard, right? Okay, and then your ergonomic hazard, and then I can see it is very a simplified version where you focusing on bad posture due to the fact of the inappropriate furniture design lah, I believe. Okay, and then based on your poster also, I can hear and then I can see that you are trying to simulate the original condition. But my idea is this is one of the improvement, not saying that what you did is incorrect, but it's for future improvement. Hopefully, you can make some sort of revision, Puan Amalina. Is that okay?
Okay.
Okay, so the first one for your ergonomics, actually you need to give also a comparison. What is the good posture that you are talking about? And then when you are trying to give a comment on a specific non-adjustable height condition, and then what I would like to say is a poor furniture, you should also have the ability to suggest what kind of the best furniture that should be redesigned or reordered by your department lah. So that is will fruitfully give some insight to your management. Faham tak maksud saya? Maknanya you bukan saja cerita this is not good, this is bad and so on and so forth, which is very good highlight in terms of the risk assessment process. However, you also need to try lah your best in the ability of giving suggestion. What do you think is the best at the moment? Okay, Puan Amalina. So what do you think? At the best for the moment, chair yang ada tu buat apa?
I want it cushion sikit. Lepas tu nak dia
Okay,
ada little bag for resting a
little back
while.
support.
Because we will
Okay.
be busy for 5 hours at least. So we need
Wow.
something
Okay.
to rest on.
So actually, it's a very high intensive work, and then I believe the furniture design is one of the very important mechanism lah. And then I also would like to suggest if you can highlight this one, you can also put inside your high right. You see, because the malathion lotion also is being handled in that room or not handled in that room? No,
Malathion
on the
is
other
handled at a regular place also can, because it is not
regular place.
dia
It's not hazardous lah.
meluap.
Okay. Okay, okay. It's not overoperated. All right. So that is the first idea from my side in terms of ergonomics. All right. Another one from the ergonomics perspective, actually, you can revise your poster by adding the first one just now is a suggestion. Okay, that one is very, very, very true. What you said just now is also a good idea. And then the second one, perhaps you can also, because you dah tunjukkan gambar yang orang macam ada element of awkward posture, betul Puan tunjukkan tadi kan gambar orang tu macam kena bongkok dan sebagainya. Why not you try to use the ruler or riba that we already discussed in the class to evaluate the number of risk, the risk score that already being obtained from that. So if the people want to know more about ruler and riba, please come and join your kursus. Macam tu lah kan. So it is create some sort of intuitive and informative additional lah. Now because you are so good, your presentation also is very insightful. So I believe the comment also towards the more advanced people lah. So that is the first one Boleh Puan Amalina buat tambah baik kat situ sikit. Itu tambah baik je lah untuk make your output much more better Okay, the second one is about your high rank. Okay, I believe one of your materials that you explain, some of it are already covered and also specified high risk. Betul tak? High risk kalau Puan tengok dekat Puan punya slide tadi yang saya tengok daripada your submission in iBest lah. Malathion ni yang ada the activity number 3, you are talking about the internal mixing. Betul tak? If I'm not mistaken. Betul kan?
So
So
I re-evaluate after this presentation, so I'm changing it to tahap risiko. Dia punya tahap risiko I complete it to 9.
Okay. Never mind. So just nak tanya yang the activity is still the same? I mean the internal bencohan tu still ada?
Still ada. So
Still ada, but you
is
it's present, but you assess the risk to be not high risk but more on the moderate risk lah.
risk.
Oh, okay, never mind. So if that's so, then it should be okay lah for the moment, because I believe internal mixing ni actually should not be happening. Sebab inaccuracy of the ingredients mixing tak boleh berlaku disebabkan kalau you follow SOP. Unless if the officer or the technician involved in this manipulation of drug did not follow the recipe. Dia ikut resepi dia sendiri lah. Dia ikut resepi sugu pavrita ke apa kan. Dia jadi lain lah. So never mind lah. That one is actually being specified. Cuma saya don't believe it can be very high lah. Unless you already revise it, then it's okay lah. So far so good, Puan Amalina. I think everyone clear about your presentation, and it is very concise, sharp, and very informative. I'm looking forward for your resubmission, not resubmission of everything lah, most probably about the changes needed lah based on our comment. Congratulations Puan Amalina for your presentation. Please hold on a second for a while in the backstage, and then we are going to discuss furthermore after this. Okay, ada apa-apa Puan Amalina nak tambah? Silakan.
Tak ada. That's all. Thank
Okay,
you for having me.
Yes, if you don't mind, where you come from? I mean, you are from hospital or university or what?
I'm from Hospital Sibu, Sarawak.
Oh, Hospital Sibu, Sarawak. All right. Never mind. So we wait for a while, Puan Amalina. After we end this live, we are going to have an internet discussion, and after that we finish. Okay, for those who are watching live this video, thank you for watching, and then please continue because we got another 2 presentation. Okay, bye-bye. Assalamualaikum and very good morning.